going from place to place, place. Good morning, good morning, morning, good morning, morning.
Welcome back to the morning show here on Tobago Updates Television, and thank you so much for staying with us. We continue conversations this morning, and in studio we speak with Mrs. Quamina, the chairman of the Cane and Bonacor Diabetes Association, and Dr. Maxwell Adeyemi, chairman of the Scarborough Diabetes Association. And today we're speaking about Diabetes Day Health Fair. Good morning and welcome.
Good morning.
Right, and so we're talking about a health fair as it relates to diabetes. And we know diabetes is a conversation that we need to have a little bit more of, especially in our local spaces in the Caribbean and among people of our ethnicity. So tell us a little bit, give us a little history as to what diabetes is and the significance and importance of the health fair that is going to be held.
Well, basically, we know that diabetes is a chronic disease that affects quite a lot of persons on the island. The incidence in Trinidad and Tobago is in the upward of 14% of the population. Yeah, and that is those who are aware. The teaching is that half of those people who are diabetic are not also even aware that they are. So you may have incidence of 2%, but there actually may be 4 or 5. So this is a chronic disease that affects practically everybody, every household, and therefore the essence of our fair is to raise the awareness, create an awareness of screening so that people can actually get tested and be able to determine, their status and take interventions.
Is there an age range? Because I know there are some diseases or some situations that is relative to age. Is there an age range? Let's say by the time you get to 40, you have to start checking for diabetes, or by the time you are 60, you have to start checking, or is it as long as you are breathing? Is there a specific range you look for? Tell me a little bit about that.
We think as much as you are breathing, you should start to look, because some people, some children, they are born diabetics, and as from small age, some could be 4, 5, 8. We have juvenile diabetics, and you really have to look out for them.
So there's no discrimination with age.
None.
Are there things that you can use to identify that perhaps you might be falling in a diabetic category, or is it just because at 6 years old, how would I know that I need to take my child for screening for diabetes? Are there signs that you look for, or how do you approach that situation?
Yes, they could have signs like let us say wetting of their bed often. That is one of the main things in children, and for that you take them to the doctor, and then they would observe as they do testing other things leading up to that.
Yeah. And in terms of, I know part of the way we eat,
Yeah.
and our recreation, our socialization can contribute to having diabetes or living with diabetes. And what are some of the things that we can do generally, whether you have diabetes or you do not have diabetes? What are some of the things that we can do to help us to live healthy enough, or in a healthy space where we reduce the risk of or manage if we have diabetes?
Well, in reducing it, you should use less sugar. And for the children, most time the infants, the mother would give them sugar tea, sugar snacks. You should start from beginning, not giving them those sugar snacks and so forth, even when they are small, all 2 years, 1 year, where you start introducing food, you should not give them sugar meals.
And of course, you have to include the exercise and stuff like that as well.
Well, the little ones would exercise a lot,
right?
But the older one, we introduce exercise, which you can do gardening, go walking, go on the beach, swimming, little things that they may able to do. They are all exercise. Maybe walk up the steps if they have steps, walk up the steps up and down in the day. Do little things that would keep them going.
And from your experience, and in the Tobago space, I know you mentioned that 14% of Trinidad and Tobago probably has affected by diabetes, and it could be more. This is just what is on record. In the small spaces that you occupy in your communities, let's say for Cane and Bonaccord or Scarborough, where people come in, what are the numbers looking like in ratio to the persons who are residents here in Tobago?
The number are more or less comparable to what you find in Trinidad as well. If not, Tobago is a little, on my own little experience, a little more because of the population that we have. For a population of maybe 50, 60,000 people, and the number of the people that we see in the lifestyle diseases clinics, I think were a little too much. All right, and therefore there has to be some kind of intervention at some point that will create some kind of degree of reduction in the ailments that we get.
And so the opportunity here is now for the diabetes health fair that is taking place. So let's talk about the actual fair, when it is going to take place, and what participants can expect when they come to the fair. So I see the fair is taking place right here on the Port Mall in Scarborough on the 14th, which is Thursday. So let's, I see stuff like foot care, eye screening and stuff like that. Let's talk about what persons can expect when they come in here on Thursday.
Right, this is an initiative of the two branches of the Diabetes Association of Trinidad and Tobago. We do have a national body that is based in Trinidad, so Tobago has two branches, and one in Canaan, one in Bonaccord. And basically we are teaming up to create this Diabetes Day awareness, because we know November 14th is the World Diabetes Day that is, globally, observed. So we're going to be having screening right at the Port Mall here for diabetes, for hypertension, cholesterol and weight and height and all those things will be there. Then we also have screening for eye complications, foot care complications. We also will be having hearing testing. The vaccination team or the immunization team will also be here for people who want to get their vaccines. There's going to be an opportunity to get vaccinated on that day. So we'll have a whole range of activities, giveaways and stuff like that, because we do have a collaboration also with the Eastern Credit Union. They have donated some glucose testing machines. All right, so we will be able to give out some of those on that day. And there will be also some games and excitement for young people, puzzles and quiz and different kind of things that will keep people excited.
I like the fact that it will be engaging, but what I'm more interested in is, you're talking about foot care, eye screening, dental screening, nutrition screening. Are these some of the things that are impacted by the diabetes disease? For instance, your eyes and your dental and your feet. Are these some of the things that you are saying that?
Basically, diabetes affects from your head to your toe, practically every organ. So we try to focus on the different organs, okay, because you do have eye problems when you have diabetes eventually. You do have dental problems, you do have feet problems, and then the nutrition part of it is to try to guide you in terms of how to, navigate your eating habits to keep your glucose level down. Basically.
And so during the fair that is taking place on Thursday, when patrons come through for screening, is it that they're going to be like a mini consultation in terms of, giving them the information and, the guidelines as to where they can go next? Because let's say, for instance, I'm strolling through the mall and I see the fair, I participate, I get tested, and I realize that, oh, my number's a little bit high. What happens next?
We normally refer them to their health center, which community they belongs to. They go for referral there. Yeah.
Okay, well, that's good because, sometimes we just need to have that measure of support in terms of ensuring, you don't want to get startled and then what happens next. So that measure of support is there, of course. And I do hope that people come out. Tell me what time is happening from?
9 until 3.
Okay.
Yeah. And I must put in a plug there, not only this community event we are doing, we do schools too, where we pick up children who are diabetics in early age, hypertensive, and we refer them to their community health center.
That is absolutely amazing because, as I said, you want to detect early and put the right steps in place to ensure that these things can happen. And I want to, make a call for all of Tobago. Your health is very important to you. And as Dr. Max said, that the figures, the statistics is based on what is on record. You might not know what your position is. You might not be on a record, so you do not know. If you have the time on Thursday, if you're in the Scarborough area, come down to the Port Mall between 9 a.m. and 3 p.m. to get tested, get screened, get the information and the referral if you need it. And also, just get the encouragement to live that type of healthy lifestyle. Is there anything else you'd like to share with our viewers before we close?
We have the agriculture department. They would be there not only giving you plants, but telling you how you can grow plants, because sometimes we don't think we can grow them even in our little blocks hole or in our little flowers pot among the flowers, in the hanging baskets. So they will be there to encouraging you.
Right, so it's a holistic type of space that you're creating for persons to be able to, participate there and get the numbers, know what is happening, and referrals. Dr. Max, in closing, is there any other information you'd like to share?
Yeah, basically, my note is that don't assume that you're okay. Don't just come to the conclusion that you're okay, get checked out. Because a lot of us think that we're okay. Because we're bouncing around up and down the place and everything seems right and nice for the time being. I think we should disabuse our mind. It doesn't matter. You could be a nurse, you could be a manager, you could be a supervisor, you could be a doctor, you could be... Diabetes is a disease that does not discriminate on any body, profession, age, or whatever. So don't assume that you're okay. Take the step to get checked. Take the courage, I should say, because a lot of us are afraid to get checked sometimes. So get the courage to get checked and be sure that you're okay.
Very, very sound advice there, of course. It really is a courageous thing to do because, as you mentioned, especially culturally, we kind of take a back seat as to, our health. We don't take the proactive approach. So that's very, very sound advice there. Remember, it is happening this Thursday right here on the Port Mall from 9 a.m. to 3 p.m. And I believe it's absolutely free. You don't have to pay for the screening. Of course, in collaboration with the Eastern Credit Union, helping out there with the machines, the glucose testing machines there as well. Lots of fun, games, excitement, quizzes, maybe just for you to know, or to know if you know, and to, of course, educate you on things related to diabetes and your health as well. So if you do have the time, do pass by. Ladies and gentlemen, this is where we have to end the morning show here on Tobago Updates Television, but it's not where we end our programming. We head on over to GMT. And as we go, we do want you to have a wonderful day. But before we go, we ask you to help us. Share the live, share the live, share the live. Stay with us.